Hello, we are pleased to present to you an overview of the Lonoke County Assessment. But first, let us welcome you. We are excited to have you as our new County Public Health Administrator. This section will begin the County Health and Healthcare Assessment. The population statistics for Lonoke County, according to the most up-to-date statistics on the United States Census Bureau website, list the population of Lonoke County as 73,309 people. This is a 7.2% change from 2010. The demographics of our county are also included here, with our population being composed of the following: 25.4% under the age of 18, 13.8% over 65 years old, white individuals composing nearly 90% of our population, and African Americans only 6.3%. As you can see, our county has an average life expectancy of 75.4, and generally it ranks better than the rest of the state in our citizens' health status. The leading cause of death in Lonoke County is comparable to Arkansas, with slight variances including cancer ranking as the number 1 cause and accidents ranking in at number 3. Our citizens have better access to healthcare compared to Arkansas overall, with about 8.3% of our population being uninsured. Healthcare professionals within Lonoke County are considered to be more readily available than many other counties with us in this purple region right here. And this will show the patient population per 10,000 people. When we look closer at our provider access, though, we can see that our statistics are worse overall from Arkansas, and this is likely because we have fewer physicians and doctors in comparison. Our primary care physicians have approximately 3,750 more patients to take care of than the state average. Likewise, dentists have nearly 1,700 more patients. Mental health providers have about 1,200 more patients, and other primary care providers have 670 more patients per provider. Current facilities within Lonoke County include urgent care clinics, specialty clinics, and primary care offices. There are no hospitals located within Lonoke County. Disparities within the health outcomes include the following. Worse outcomes are indicated in red, while better outcomes are indicated in blue. These outcomes are in comparison to the subgroup of white citizens. Generally, Black citizens have worse outcomes, and Hispanics have better outcomes in everything indicated except for flu vaccinations and median household income. The overall health behaviors of Lonoke County vary from the state. As you can see, we rank better in some areas and lower in others. Overall, our trends indicate that we have room to improve our health behaviors, particularly smoking, obesity, and overdose deaths. This particular map indicates how Lonoke County is not the worst, but also not the best. We definitely have area to improve, and this is generally indicated for all of the health trends, including the overdose deaths.
Now that Abby's discussed some of the demographic characteristics of Lonoke County, I'm going to briefly talk about some of the effects the Affordable Care Act may have had. So Arkansas didn't technically expand Medicaid through the ACA, but they did expand it in a modified form where they used the funds to purchase plans from private insurers, and which they then offered through the marketplace to those who qualified. This was put into place in 2013, and as you can see from the graph taken from county health rankings, the percent uninsured starts to drop at exactly that time. This resulted in direct benefits to those who were previously uninsured, as they now had access to care that they previously couldn't pay for, but now could, directly as a result of the ACA. So when thinking about health equity as it relates to the ACA and Medicaid expansion, it's important to look at who was most affected by the inability to pay for insurance prior to the ACA. This is data from the American Census Bureau looking at poverty by race in Lonoke County. And as you can see, although black individuals make up only 7% of the population in Lonoke County, they are more than twice as likely as white individuals um, to be below the poverty line. And so in this way, the ACA was a step towards addressing some of the health inequity in Lonoke County. So some of the potential burns. The study at the bottom of the screen uh, was assessing the effect of the ACA nationwide after 5 or so years. One of the more interesting findings they reported were that Medicaid expansion states and non-expansion states had similar increases in the rate of individuals who reported having a primary care physician. One of the potential reasons for this is that while Medicaid coverage did increase, Medicaid notoriously reimburses less than other types of insurances. So how does this relate to Lonoke County? Well, the graph on the right of the screen shows the breakdown of which individuals, or the percentage of individuals who had which type of insurance. And you can see right around 2013-14, Medicaid spikes. On the left, you can see the ratio of patients to primary care providers in Lonoke County. Over time, it doesn't really change. And while this isn't evidence that access to primary care providers hasn't increased, it isn't encouraging that it has. And this could be one potential drawback of the ACA, is that Medicaid expansion doesn't necessarily automatically result in an increase in access to primary care.
There were several needs assessed and discussed as it pertains to Lonoke County within our presentation. It was previously highlighted that Lonoke County lacks a hospital or emergency facility. The leading cause of death was cancer, which was not directly correlated to this factor. Our assessment also revealed that cancer being fatally prevalent within the county could not be directly attributed to the lack of providers or clinical facilities. We were then drawn to the conclusion that the culprit of cancer being the leading cause of death in Lonoke County is the lack of county appropriate public health programs. For this reason, we have constructed a public health program that would alleviate the strain that cancer has on the Lonoke community. On the current screen are the program basics, in which I will discuss in further detail. The program will be a mobile cancer center in which three major public health tiers will fall under. The first being on site screening. This mechanism will allow early detection to be possible and appropriate education and aid to be received. The second, which supports the first, is cancer education for the at risk community, educating the community on early detection and early action plans. Lastly, in the event that someone has been confirmed to have some form of cancer or high risk for it, they will be directly connected with a local provider who will be able to give them the appropriate continuity of care. An additional benefit that is within the name of the program itself is the ability for this mobile cancer center to be mobile, meaning that it can virtually serve anywhere within the Lono community, leaving no zip code or geographical location untouched. In the following slides, I will discuss how this program will function in the aspects of community and stakeholder involvement. We will first invite community involvement through our social media platform and local news and newspaper campaigns, allowing members of the community to be aware of us and our purpose, and also granting them the opportunity to know what location we will be serving within the area, as well as giving them the opportunity to give us feedback on what locations within the Lono community are most convenient for them to arrive to. By creating this outlet of open communication within the community, we can maintain an optimum community involvement and feedback. We will also partner with local churches, providers, legislators, and community leaders to ensure that our program not only gains the confidence of those in the community, but those who are the foundation of the community as well. Through working hand in hand in these partnerships, we will create a strong community confidence to receive health education and aid. Now we'll discuss how we will work as a team with stakeholders to ensure that the program works as optimally as possible and remains an efficient cancer center as well as a pillar in the Lono community of public health care. We intend to partner with the local providers, equipping them with the aid necessary to effectively care for cancer patients that will be referred to their respective facilities and clinics. After establishing a close-knit relationship with the Lonoke County providers, We will then reach out to bigger surrounding facilities for financial backing as well as proper protocol education. Facilities such as the UAMS Winthrop P. Rockefeller Cancer Institute will be our primary partners, equipping us with necessary staff and education needed to serve the Lonoke community. Through the educational standing received from this facility and well educationally equipped staff, we will be fully equipped to serve the Lonoke area within any area of cancer screening, treatment, and education. This symbiotic relationship with the UAMS Winthrop P. Rockefeller Cancer Institute will not only highlight their exceptional education and clinical skills, but also present them as public health advocates with a personal foot on the ground. Within any transaction, there may be a conflict that may arise. Serving in the Lonoke area may cause some discomfort of relocation as well as inconvenience to staff on their current living standings. This would be separated by providing significant financial allocation for relocation as well as appropriate transportation for all staff. Another issue may arise that staff may not want to serve at this capacity on the mobile unit for their entire tenure. This will be resolved by creating an operating shift schedule in which various staff could work in a well-balanced shift schedule that allows them the ability to not relocate as well as maintain a healthy life-work balance that prevents burnout while serving on the mobile health unit. With any opposition that arises with stakeholders, one truth must remain at the center that terminates any opposing thought process, which is the reason why the Mobile Cancer Center is operating, and that is to directly aid Lonoke County with the educational and medical resources necessary to provide access to early detection and medical services to treat when needed. With this at the forefront of any stakeholder involvement, any disagreement or discrepancy is negligible. This following slide concludes our presentation with the references that were used to obtain all data and outside knowledge. Thank you for listening.